So, welcome to today's session. Myself, Rajita. Today, we are going to discuss regarding a very important topic related to the cardiovascular system. It is a kind of disorder or disease which is occurring into the cardiovascular system, mainly affecting the heart and its function. So, the topic is dysarrhythmia. So, let us discuss today regarding the dysarrhythmias in detail. Dysrhythmias is nothing but a abnormal rhythm of the heart. So, just to give you a revise, already we have studied that heart will be maintaining a regular contraction and relaxation, and it will be maintaining this pattern in a rhythmic way. But here in this particular condition, we are going to see the person or the individual will be having a altered rhythmic pattern of the heart. So let us discuss now regarding the definition of the dysarrhythmias. So, dysrhythmias can be defined as an abnormal rhythmic contraction and relaxation of the heart, which is basically caused by some underlying pathology or pathological changes, which is affecting the conduction system of the heart. I'll repeat once again here the definition of the dysrhythmias described that it is an abnormal condition where we are going to see the heart will be having an abnormal rhythmic pattern, or the contraction and relaxation of the heart will be in an abnormal rhythm. So that is the reason when we are going to see that there will be alteration in the cardiac function. So, and the major cause of this development of dysarrhythmias is some underlying pathological changes which is affecting the cardiac conduction system. So now let us discuss about the normal conduction system of the heart. So already we have studied in detail how the conduction system of heart functions here. So let us discuss now about once again that basically the conduction system of the heart will be consisting of certain specialized cell, which is basically will be present over the heart and heart muscle layer itself. So we are going to see the specialized cells will be including the SA node, that is nothing but sinoatrial node, the AV node or nothing but the atrioventricular node, and a bundle of His and Purkinje fibers. So these four components are the specialized cell structure. So basically here the SA node is considered to be the pacemaker of the heart, which will be generating the electrical impulses, and followed by it will be coming or converging towards the atrioventricular node, and it will be circulated throughout the bundle of His and the Purkinje fiber into the ventricular muscle layers. So I hope we have already studied how the electrical impulses are generating and causing or maintaining the depolarization and repolarization of the heart muscle cells, which is maintaining the heart rhythmic contraction and relaxation. So also a very important part or very important part which is maintaining the conduction system in the body is our nervous system. Generally, we are going to see here the autonomic nervous system will be controlling the activity of the rhythmic pattern of the heart. Vagus nerve of sympathetic branch nervous system, we are going to see it will be maintaining the heart rate, whereas also some branches of parasympathetic nerve also will be included in the maintenance of the conduction of the heart. So that is how the specialized cell that are SA node, AV node, bundle of His and Purkinje fibers, as well as the nervous system. Basically, the autonomic nervous system includes its both of the branches, that is sympathetic and parasympathetic branches, will be maintaining a normal cardiac rhythm or normal cardiac contraction and relaxation. So, as we have learned here that dysrhythmias is the altered level of the rhythmic pattern of the heart. So, what are the causes or what are the probable condition can actually develop this condition? Let us study here about the etiological factor and the risk factors, which is often will be associated with the development of this condition of dysrhythmia. So basically, whenever our individual will be developed with dysrhythmia, we are going to see the alteration will be taking place in majority three ways. So the first one is there will be problem or alteration in the automaticity or the impulse generation. So in very precise, as we have learned, the sinoatrial node or the pacemaker of the heart will be generating the electrical impulses from them, which will be generally regulating the heart contraction and relaxation. But here, if any underlying disease process or any pathological condition is causing altered level of the automaticity or electrical impulse generation from the sinoatrial node, we are going to see the person can present with dysrhythmias. So the next alteration will be taking place definitely into the conduction pathway of the impulses. So in this case scenarios, we are going to see the individual will be having altered conduction pathway. So in precise, the generation of the electrical impulses from the SA node here will be normal. But we are going to see the while this electrical impulses is traveling through the conduction pathway, as in it is converging to the atrioventricular node, then it is coming to the bundle of His into the Purkinje fibers. There, if there is any blockage or alteration is present in this pathway, then we are also going to see the person will be present with the sign of dysrhythmias. So we have seen alteration either into the electrical impulse generation or into the conduction of the electrical impulses toward the conduction pathway can actually cause dysrhythmias. Now, you have to remember one particular very important thing, that the combination of this both also can cause dysrhythmias in some individual. There we are going to see in those cases the person will be having a altered impulse generation even from the sinoatrial node, as well as they will be having certain blockage over the conduction pathway. That is the reason even there will be altered level of the conduction of the electrical impulses throughout the ventricular muscle fibers. That is the reason this combination of this both is going to cause a altered rhythmic contraction and relaxation of the heart. And we are going to see the presence of dysrhythmias. The next etiology is the re-entry of the impulses. So if there is any blockage present in the conduction pathway, we are going to see the electrical impulses will be having a re-entrance to the previously excited cells. And this re-entrance of the electrical impulses will cause a premature beat or a premature contraction. That is the reason a re-entry of the impulses also will ultimately develop the condition of dysrhythmias. So now we are going to read here what are the disease condition is related with the development or causing the alteration into the particular conduction pathways or the electrical impulses generation. So now let us discuss regarding the risk factors or the disease condition which is present underlying and causing an alteration either into the electrical impulses generation from the pacemaker or in the conduction pathway of the heart. So first we will be seeing the disease condition which is present underlying and causing a alteration in the automaticity or into the generation or into impulse production. So the main and most important disease condition which is often related with the alteration of the automaticity or the impulse generation is myocardial ischemia. Now, we have studied in details regarding the myocardial ischemia. We have also seen that ischemia will be basically causing necrosis of the cell. Now, suppose the necrosis or the deprivation of the blood is occurring into the area where the AC node or the pacemaker is present. Definitely, we are going to see the automaticity or the electrical impulses generation will be altered here. So majority of the cases, myocardial infarction is almost always will be associated with the development of dysrhythmias, because the myocardial in ischemia ultimately is going to cause alteration in the electrical impulses generation. So the next disease condition which is associated with the alteration in the automaticity is the left ventricular altered function, or basically the left ventricular dysfunction, or if the left ventricular function is decreased. So here we are going to see this particular condition can ultimately affect the rhythmic contraction or the impulse generation from the heart. That is also will be ultimately associated with the development of dysrhythmias. Next causes is valvular disease. So as we know, the valvular disease will be basically occurring into the valves of the heart, and which is basically will be almost always involving the mitral or the tricuspid and bicuspid valve. So here we are going to see the alteration or the inflammation into the valves is ultimately going to affect the nodes or the pacemakers of the heart. So basically, because of the valvular disease, even we are going to see there will be effect into the sinoatrial node and its impulse generation. So that is the reason valvular disease often will be causing dysrhythmia and ultimately will be causing a altered level of impulse generation. Electrolyte imbalance is one of the most important cause which will be ultimately developing the condition of dysrhythmias associated with altered electrical impulses generation. Administration of atropine. So this particular drug will be directly affecting the cardiac function, and which will be ultimately alternating the electrical impulses generation from it. So administration of atropine also, as a side effect of it, we are going to see that there will be presence of dysrhythmias. Next, we are going to read about the disease conditions or the factors which is causing the dysrhythmias by alternating the conduction of the impulses. So basically, in these cases, often we are going to see the person will be having a normal electrical impulses generation from the pacemaker of the heart, but the conduction pathway will be having difficulties or altered pathological case. There is a reason why the impulse conduction or the flow of the impulse throughout the pathway will be altered. So ultimately, that also will be causing the presence of dysrhythmia. So let us discuss about the disease conditions which are alternating the functions or which is alternating the conduction of impulses. So first one is myocardial ischemia and valvular heart disease. Now you have to remember myocardial ischemia, valvular heart disease can affect any or part of the heart. So even it can affect the pathways as well. So suppose the ischemia or the myocardial ischemia is occurring in an area where the bundle of His is involved. So definitely we are going to see the bundle of His in that particular ischemic place will not be able to work enough. That is the reason we are going to see here also the conduction of the impulses will be altered. Same way, the valvular disease also ultimately can affect the atrioventricular nodal area. So the valvular disease which is causing the atrioventricular nodal areas alteration, we are going to see because of that the electrical impulses convergence into the atrioventricular node and the conduction of the impulses will be altered here. And ultimately, the valvular disease can lead to the development of dysrhythmias by alternating the conduction of the electrical impulses. Inflammation of the AV node or atrioventricular node also will be associated with the development of dysrhythmias, because inflammation of atrioventricular node will be ultimately causing altered conduction in it. So as we know from sinoatrial node, the electrical impulses will be generating and it will be converging into the atrioventricular node. We are definitely going to see here if there is any inflammation or disease process is affecting the atrioventricular node, the whole pathway of the conduction will be disturbed. And that is the reason why the electrical impulses will not be able to conducted throughout the pathway, and we will be seeing a altered contraction and relaxation of the ventricle. Next, we are going to see again the electrolyte imbalance also will be causing the conduction of the impulses alteration. So ultimately that can develop the condition of dysrhythmias. Digitalis toxicity. The toxicity of the digitalis drug is basically will be alternating the conduction of the impulses throughout the conduction pathway. Beta blocking agent also can sometimes leads to the development of dysrhythmias because it will be alternating the conduction of impulses throughout the ventricles. So I hope we have learned here what are the basic etiological factor that includes the alteration in the electrical impulses generation and the disease condition which is causing it and causing or ultimately is developing the dysrhythmias. We have also studied about the second factor, that is altered level of the conduction of the impulses throughout the pathway, and we have seen the disease process which is basically causing the alteration into the conduction of the electrical impulses throughout the pathway and ultimately causing the dysrhythmias. Now here we are going to read about the second or the third most important factor which is causing the dysrhythmias is the re-entrance of the impulses. So as I have noted before, that if there is any blockage present over the conduction area of the heart, we are going to see if this blockage is unidirectional into the heart conduction pathway. This uneven conduction may allow the initial impulses which has been generated from a primary or a secondary pacemaker to re-enter to those areas that were previously excitable but not have been recovered yet. So basically the re-entrance of the impulses will occur into those previously excited cells which still not yet recovered from the excitable state. That is the reason why the re-entrance of impulses will be ultimately causing extra beat or premature beat for the heart. Now, this re-entering of the impulses will ultimately cause the depolarization of the atria and ventricle, which will be ultimately causing a premature beat of the heart. So that is the reason why re-entry of the impulses also will be associated with the development of abnormal rhythmic contraction and relaxation of the heart. So let us discuss now the risk factors or the disease process which are often involved with the re-entry of the impulses by which they will be developing the dysrhythmias for a particular individual. So the risk factors or the conditions include the myocardial ischemia and anti-dysrhythmic medication usage. So basically this two factor will be ultimately helping to impulse to get re-entrance into those muscle cells or those myocardial cells which are excited before and not yet recovered. Even myocardial fibrosis and bundle branch block also can cause this re-entrance of the impulses to the previously excited myocardial cells. Now, this four factors or this four disease condition is very commonly associated with the development of re-entrance of the impulses to the excited cells of the myocardium. Now, you have to remember this all disease process will be ultimately affecting the impulse generation or the conduction of the impulses or a combination of it, or it will be causing the re-entrance of the impulses into the previously excited myocardial cells. That is the reason why we are going to see the person will be having abnormal rhythmic pattern, because there will be alteration into the conduction system of the heart, and we are going to see the person will be present with dysrhythmias, and the types and will be varying depending on what kind of pathological process has been occurred and which are the areas of the conduction system have been occurred because of the pathological condition. Now we are going to discuss here some other associative factors which also can almost always develop the condition of dysrhythmias. So this includes our acid-base imbalance. So as we know, in our body the pH will be maintained in a 7.35 to 7.45 level. So we are going to see if there is an individual who is present with a acid-base imbalance. For them, the alteration of the conduction is very much common. Even sometimes they will be present with objective phenomena or clinical manifestations of dysarrhythmias if they are having a acid-base imbalance in their body. So the next condition is alcohol consumption. Now, this alcohol consumption ultimately can alter the conduction system or the impulse generation from the heart muscle layers, or basically we can say the alcohol consumption will ultimately can affect the automaticity of the heart, that ultimately will be causing the development of dysarrhythmias. Excessive caffeine and tobacco consumption also considered to be one of the most important and major risk factor for alternating the conduction system of the heart, which is ultimately will be causing a altered level of impulse generation and will be causing a dysrhythmia. So excessive amount of caffeine and tobacco consumption also is considered to be one of the major risk factor which is alternating the impulse generation and ultimately will be causing a altered level of the rhythmic pattern of the heart. Connective tissue disorders also will be associated with the development of dysrhythmias. Electrical shock, if it is present for a person, it ultimately can cause the impulse generation from the SA node or the pacemaker of the heart, and ultimately will be causing or developing the condition of dysrhythmias. The next condition which is associated with the development of dysrhythmias is emotional crisis. Now, emotional crisis or excessive stress or environmental stress ultimately can cause altered level of the nervous activity in the body, which will be ultimately causing increased heart rate and ultimately in a long term, which will be causing a altered level of the conduction inside the heart. Hypoxia also can cause a altered level of the heart function or the conduction system of the heart. Sepsis or a systematic shock also sometimes will be associated with the dysrhythmias, because this sepsis or the shock will be ultimately causing electrolyte and acid base imbalance in the person, and ultimately which can affect the impulse generation and the conduction of it. So ultimately, it is going to cause the presence of dysarrhythmia. Toxicity of certain drugs also will be associated with the development of dysrhythmias. So I hope now you're completely clear regarding each and every etiological factor and the risk factors which can alter the impulse generation or the conduction of it throughout the conduction pathway. Also can cause the re-entrance of the impulses, which will be ultimately causing the development of dysrhythmias. Now we shall discuss regarding the pathophysiological process, how these etiological factors is affecting the whole functions of the heart and causing some clinical manifestations development in a particular individual. Let us study here. So while studying about the pathophysiology, we are going to see all the etiological factors and risk factors ultimately will be affecting the cardiac function, basically the myocardial functions of the heart. And definitely, this dysrhythmias will be having an effect on the cardiac output ultimately. That is the reason in a long term we are going to see the cerebral and the vascular perfusion in the body of that particular individual will be almost always altered in the process of the pathophysiology of the dysarrhythmia. So, as we have seen that there will be alteration in the cardiac function, definitely it will be affecting the cardiac output. So the significance of the dysrhythmias basically, definitely it will be affecting the cardiac output. So as we have learned into the pathophysiology that the all the etiological factor and the risk factors will be ultimately causing altered contraction and relaxation of the heart, which will be ultimately causing a decreased cardiac output. In a long term, we are going to see in this pathological process of the dysarrhythmias, a person will be having altered cerebral and vascular perfusion in their body because the cardiac output will be decreased here. Also, we are going to see that there will be altered level of the heart rate and stroke volume as well. That is the reason the cardiac output here will be altered and will be causing the clinical manifestations into a patient. So, as we know, during the normal sinus rhythm, the generation of the impulses will occur at SA node or sinoatrial node, which is known as the pacemaker of the heart. Now, in altered condition, so suppose there is presence of any underlying disease process which is affecting the conduction system of the heart, we are going to see in those altered condition there will be dominance of the secondary pacemaker here. Now, secondary pacemaker ultimately will be dominating the primary pacemaker or sinoatrial node. Now, secondary pacemaker can be placed in atrium, even into the atrioventricular node, even into the bundle of His and Purkinje system. Now, if the secondary pacemaker is getting the dominance, we are going to see there will be alteration in the cardiac rhythm pattern. So, as we have seen that the secondary pacemaker will be having the dominance, and when they are producing the electrical impulses, definitely the heart rate and the conduction pattern or the rhythmic pattern will be changed. In next cases where there will be blockage in the conduction pathway, we are going to see the electrical impulses will be having or will have to face this blockage in the pathway. Now, will not be effectively can cause excitement for the myocardial cells, which is ultimately can cause altered rhythmic pattern of the heart. Even the re-entrance of the impulses to the excited myocardial cells, which has not yet recovered from the excited state, will also cause a premature beat of the heart. Now, this all factors togetherly will be causing a altered functional level of the electrical impulses. Also here, the depolarization and the repolarization will be altered. That is the reason we are going to see the cardiac muscle layers will be maintaining an abnormal pattern of contraction and relaxation, ultimately will be causing the development of dysrhythmias. So the clinical manifestations associated with the dysrhythmias, basically the objective manifestations will be almost always palpitation. So a person will be often complaining about the palpitation, dizziness, syncope, or the episodes of syncope will be almost always present in case if a person is developed with dysarrhythmia. There can be presence of pallor. Diaphoresis is most common manifestations, or we can say initial manifestations, if a person is having a altered rhythmic pattern of cardiac contraction and relaxation. The next is lethargy. So, person will be almost always feeling lethargic or having excessive fatigue related to it, as the cardiac output will be altered here in dysrhythmia. So definitely the perfusion will be decreased for a person. That is the reason why the lethargy and fatigue will be very much prominent in those patients who are suffering from dysrhythmia. Restlessness, and in an excessive way or in an extended case scenario of dysrhythmia, even the person can go for a altered level of consciousness as well as coma. So basically here what's happening in an extended level of the dysrhythmia, there will be decreased amount of cardiac output, which will be ultimately causing decreased cerebrovascular perfusion. So that is the reason even the person will be present with the altered level of consciousness, and there will be a altered level of mental status, or we can say the person can even present with a coma state. Shortness of breath is a very common clinical manifestations for those patients who are suffering or who are developed with the dysrhythmia. Chest pain almost always will be present. So as we have learned, majority of the cases there will be some underlying disease process which is affecting the myocardial cells within the heart, or maybe the affecting the electrical impulses generation. So that is the reason the person can have the feeling of chest pain. Even angina can be present associated with the presence of dysrhythmia. Paroxysmal nocturnal dyspnea is a very prominent sign associated with dysrhythmias. Hypotension almost always will be present in those patients who have developed with dysrhythmias. Now, hypotension is will be caused because as the decreased cardiac output will be causing a decreased blood pressure, so a person would be often present with a hypotension associated with dysrhythmia. Capillary refill will be almost always sluggish for the patient with dysrhythmias. There can be presence of edema or swelling even into the extremities because of the altered venous return to the heart. Even there can be actually decreased urinary output. The decreased urinary output is basically caused because the renal perfusion here will be deprived. So these are the very common and very initial clinical manifestations which we are going to see for those patients who have been developed with dysrhythmias. Now you have to understand this clinical manifestations will almost always will be associated with the underlying disease process which is causing the development of dysrhythmias. Hence, the assessment of the dysrhythmias is very important to assess, because the assessment of the dysrhythmias is basically will be showing which type of dysrhythmia the person is present with, which should be the actual management or emergency intervention should be done for the client to manage the condition, as well as to treat the probable underlying cause. That is the reason we are going to learn here the diagnostic assessment, which plays a very important role to make sure that the medical professionals are having a complete idea regarding which type of dysrhythmia the person is suffering from, and what are the or what can be the underlying causes of the development of this particular dysrhythmia. So, diagnostic assessment includes the history collection. So, basically, in history collection, we are going to assess the person. First, we are going to assess the presence of the symptoms, and next, we are going to ask the client about the onset, the duration of the symptoms which they are suffering from. Also, we are going to ask whether there is any presence of any associated manifestations, as well as if a person is having any relieving factor for the signs or symptoms they are present with. So this basic data or this baseline data will be helping us to understand what are the clinical manifestations that are present in the patient, and it will be ultimately helping us to understand whether a person is having a more likely to develop with dysrhythmia or not. Next, we will be going into the past medical history, which will be basically showing the presence of any disease condition. Now, suppose a person is having a previous history of myocardial infarction, or maybe a coronary artery disease, or any other disorders which can affect the conduction system of heart. So definitely, if there is presence of such past medical history which can alter or which can increase the probability of the development of dysrhythmias. For those clients, it is to be noted that they should be sent for further investigation to conclude the diagnosis or conclude the presence of dysrhythmias. Also, we should collect the baseline data regarding a surgical history. It includes the present or past surgical history. So basically, we will be focusing on any surgery has been done with or associated with cardiovascular disease or not, right? Any coronary revascularization procedure or any other procedure which can ultimately alter the conduction pattern of the heart, we should collect the data about it. Next is the lifestyle of the particular person. So, as we have learned that certain conditions like excessive alcohol consumption, excessive environmental or psychological stress, even a habit of consumption of tobacco also can lead to ultimately the development of dysrhythmias. So, collecting data regarding the lifestyle for the patient is very important. So, here we should basically ask about their dietary habits, about their exercise tolerance or exercise pattern, their daily lifestyle, their occupation as well, and their habits. So, if this lifestyle baseline data will be suggesting a particular client or will be suggesting a medical professionals to identify the unhealthy lifestyle they are following, and definitely will be helping the client to modify those lifestyle risk factors which will be often associated with the development of dysrhythmias. Next, we are going to collect the data regarding the family history as well, because we consider that in some case scenarios, the dysrhythmias or the cardiovascular disease almost always will be associated with the genetic factors. That is the reason the collection of the family history plays a very important role over here. Next, definitely we are going to perform the physical examination as assessment for dysrhythmias. In physical examination, we are going to do the auscultation. So basically, on auscultation, we will be often finding a altered heart sound presence. So auscultation over the chest will be showing the presence of altered heart sound. Even if we are doing a ECG, there will be changes in the ECG which will be very prominent for each type of dysrhythmias. We can go for a complete head to toe examination where we will be basically trying to find out the symptoms that are present for a client and which will be associated with the case of dysrhythmias. Next, we are going to read about certain diagnostic procedure which will be very oftenly used to find out the condition or to conclude the condition as dysrhythmia, as well as it will be helping an individual or basically a medical professional to find out which type of dysrhythmia it is and which is the underlying causes of the development of it. So, as I have mentioned, the ECG or the electrocardiography plays a very important role here, because we know the electrocardiography will be helping to understand the conduction pathway in the heart. That is the reason the ECG or the electrocardiography will be showing any altered level of the conduction pathway. So each type of dysrhythmias will be showing different kind of electrocardiographical changes. So it will be helping ultimately a medical professional to conclude the diagnosis of dysrhythmias. Now, Holter monitoring is often suggested to the client who have, a cardiac rhythm or a altered cardiac rhythm, basically with a episodic altered cardiac rhythm. So here in Holter monitoring, the cardiac functions will be monitored for a duration of 24 hours. And this Holter monitoring ultimately will be suggesting if a person is having any altered level of cardiac rhythm at any time during a whole duration of 24 hours. The next is event monitoring. So with electrocardiography and Holter monitoring, if there is no finding of any changes into the cardiac rhythm, definitely event monitoring also will be done for the client. invasive electrophysiological studies also to be done. Now, this invasive electrophysiological studies is basically includes positioning of the multipolar catheter inside the heart muscle layers, basically through the venous system. Now, placement of this multipolar catheter nodes will be ultimately helping to study the cardiac conduction system, as well as it will be helping to understand whether there is any alteration in the rhythmic pattern of the heart or not. So I hope till here we have completely discussed regarding the definition of the dysrhythmias. We have seen the basic etiological factors, as well as we have seen the risk factors or the disease condition which is underlying to these conditions or the development of dysrhythmias. We have seen the pathophysiological process as well as the diagnostic assessment, which are very commonly used to find out the presence of the type of dysrhythmias and can ultimately conclude the probable cause related to the development of dysrhythmias. Now, next, we should study regarding the types of dysrhythmias, and we are going to study there every clinical manifestation related to the each types of dysrhythmias and the treatment procedure related to those types of dysrhythmias particularly.